Hello, everyone. We
Hi, guys.
we figured we'd get started a little early, let you come in and let us know where you're calling in from. Let me move it to our slide deck here. Oops.
DJ asked, do we have anything for oculoplastics? Ooh, that's exciting. I think we
Yeah,
should get something.
I'll put the link up for our topic request because
Yeah.
we've got a whole system. You put your question in, it gets vetted by one of our coders, usually Sylvia, me, or Alicia, and then it goes off to our interns and they prepare the answer sheets like you're going to see tonight. So there's a whole flow. So yeah, get your topic in there, and we're down to maybe only 20 that were left to develop. So we're hungry for more. So feed us.
Feed us. Feed me, Seymour.
So how's your week going, Alicia?
Pretty good. Been busy, but that is a good thing. If we are not busy, then, it gets boring. And there's Beseda. I know her from Brooklyn, New York.
Oh,
She found out about us through SUNY, right, Beth? And so that's great. She's been following us for some time. New Hampshire, Christopher's from. Natalie's from Pennsylvania. So it's good to see everybody. It's kind of fun to log in just a few minutes ahead of time and
yep.
see where everybody's from. We like doing that. Patricia's from Kansas, and just so you guys know, and I'm curious, some of you new people may not be aware, but we've been doing webinars for a very long time,
Yes.
and probably going back a little old school. So I'm curious now. I see some names I know that have been with us for some time, but how many of you guys remember when we used to do the answer sheets and we would get the topics in and we'd have that answer sheets that later you could go into the club and you can read all the information on, but we take just a few questions and really unpack them. And Beth says she does. Yes, Beth's been with us for a long time. So we're going to kind of go back to that.
Yes.
And
We
it's
needed more
fun.
room. We needed more room to put our
Yeah.
notes.
A slide deck just doesn't do it. It's okay for that staccato information and, updates. And we still are going to do that. But being able to really give you a breakdown, like I like to say, unpack the information. We're going to go back to that once a month, and with the questions that you guys submit. And that's what we would do. You guys would submit questions, and we'd give you a thorough answer to the best of our abilities. And it also sparks some conversation in the club. So that's great too.
Yeah, we've been doing the club webinars once a month, mostly run by Alicia, and those we're still doing. This is an additional one now, so we're going to have 2 webinars a month, and of course we're do a podcast, and we're going to do the podcast where it's also done like this. So we're going to have 3 per month. And when we do the podcast, it's going to be lighter. You're not going to need as much visual aids. And we might do some interviews and things like that. So if you'd like to be interviewed, share your story, your journey, and how you became certified, or if you're just starting and those sort of things. If you know any physicians that would like to be interviewed to share some of their clinical knowledge, or nurses, when we go over, although Alicia knows her disease processes really well. So we're going to be doing 3 a month. Not all of them will have CEUs. Like tonight's doesn't have CEUs, but what we hope to do is bundle, like say a cardio group of topics, and then we'll submit it for CEUs down the road. All the CEUs are available to club members only, but we do have 2 free CEUs in in our community, which we'll show you in the middle when we do our commercial break. But there's no certificates or anything like that tonight. It's just for learning, enjoying, and we'll be putting this up in our club area within the week with all of the handouts, all of the answer sheets, the transcript, all those goodies. So,
And we're all about education. And we've been doing that for a long time. And we hope that for those of you that are new to the CCO community, that you get a good feeling of what we can offer and you tell your friends. Word of mouth is the best way to advertise. So,
yeah. Case studies. Please talk about case studies. I'm sort of kind of doing a case study tonight, but we do want to do more case studies. And this would be probably the good one to do it, or the club one. It doesn't matter. We open it up to the public. What matters is the club members get the CEUs. So, but we need help. We need you to give us cases to code. So I'll give you another link for our case studies, because it's a little different, because sometimes people like to do attachments for that. So I'll put that in.
and Beth said she's loving the new Circle app. Thank you for mentioning
Yay.
that. I'm glad. It really makes you feel connected, right? Because it's, having that on your phone is having CCO literally at your fingertips, because you always have your phone with you. So I'm glad that that's working really well for you.
Yeah. So I put that in the chat as well. So let me start us off officially for the recording's sake. So welcome everyone to the July 2025 CCO Community Q&A webinar. I'm your host, Laureen Yandrup, and I am with our senior instructor, Alicia Scott. And we've got 3 topics prepared for you tonight. I was supposed to do a second one, but I ran out of time. So Alicia's got 2 diagnosis ones, and I have a procedure one around cardiology. So what we want to do is do 2 topics, take a commercial break in the middle, then I'll do my CPT one, and we'll at the end talk a little bit about our new community, show it off a little bit. So you're welcome to stay as long as you like, drop off when you need to, ask questions in the chat. When Alicia's presenting, I'll try and scan and show her questions if it's about her topic, and vice versa. So we're gonna tag team here.
And it's been a long time since we've done this format, so give us a little grace.
Yes.
We'll pick it up. It was bringing back memories, but we both agreed that this is a fabulous way to get our education over to you, because we can give you so much information on those answer sheets.
It's our favorite format.
It is.
So cardio coding cases, we're probably going to do maybe not sequentially, but maybe the month after next we'll do some more cardio. And what we're trying to do is like package it together in a little mini course. There's a method to our madness.
But the key is these questions are questions that come from our club members, and that Circle app. What a great way to see what people are asking. Most likely, if they have questions, it's a question that you have, so you can go in and see the conversations. We get to start with a question that came in, and I don't know without looking what her name was. Maybe she didn't give us permission to use your name.
It's
But
on the answer sheet when we get there.
it is. Okay, good. We are going to talk about the Z code for the diagnosis Z09, which you think, wait, is that a diagnosis? Yes, it is. And they had a question about which one of the codes is most appropriate for this scenario. This is real life coding. Everything has been redacted, of course. Let me just get into reading what they had said.
Oops.
The question was Z09 or Z03.89. I need assistance with selecting the diagnosis code for this case. It's a post-operative discharge. Now, you always look at the pre-op and the post-op, and most of the time they're the same, but be very cautious that the post-op is possibly different. So pay attention when you're kind of speed reading through post-op cases, you don't want to miss anything. What they have for a post-op diagnosis is an anterior communicating artery aneurysm status post microsurgical clipping. Now, when we flush this out, uh, it's these are aftercare codes, the Z09 code, and it does get confusing. So they are not actually doing a clipping right now. This is the scenario. We have a 75-year-old man with a history of previously clipped aneurysm by Dr. X. He was referred for follow-up of a cerebral angiogram to rule out significant residual. Risk and benefits of the procedure were discussed. Let's see, with a patient prior to the procedure, very common. These risks include and are not limited to vessel injury, hematoma, hemorrhage, hemorrhagic stroke. The patient understands the risks and benefits of the procedure and elects to the procedure. All his questions are answered. Informed consent was obtained. No guarantees were made. This is very common verbiage. It's almost like it's a template or auto text for most of that. And again, most of that's fodder. The first part is what we want to abstract. There were not findings after the angiogram, the angiography, and so what we want to do next, and I think, Laureen, if you can get rid of everything on the right of the
Oops.
screen. Yeah.
Thank you.
And I do have my reader so that I can see. I am not able to quite see that big enough. Let me see. Is there something I can do to make that? Yes, I can.
Is that good?
I got it. No, it's on my end. I had to make it
Oh,
bigger.
okay.
So I won't be able to see the conversations that you guys are having, but Lauren will let me know if you have a question.
Yes.
All right. So the diagnoses that she's confused about is Z09 versus Z03.89. This was requested by Beverly. She's a CCO club member. Thank you, Beverly, for your questions. I understand from Laureen, you've had some really good questions that came in, and I know your questions are part of real world coding.
Mm-hmm.
And so that truly helps other people in the club. So we appreciate you taking the time and trusting us to help you with some resources. This slide or this answer sheet was prepped by one of our interns, and I'm probably not going to pronounce her name right, but it's Priyanka Soni, and she's a CPC. All of our interns are certified. Many of our interns are working their A off, but some of them are just expanding their knowledge base.
Mm-hmm.
And of course, this isn't presented by Laureen, it's presented by me. I don't know why it had my name, I thought, at the beginning. So I wonder if for some reason we don't have the right thing up, we'll see it. And again, thank you guys for giving us a little grace. So the question is, hello, I need assistance with selecting the diagnosis code Z09 or Z03.89. This post-operative diagnosis was that anterior communicating artery aneurysm status post microsurgical clipping. Now, what we want to tell you is that the procedure that I just read on the other screen, this is not what's being done to the patient. Okay, so that can get a little confusing. What they're doing is they're going to go in and look because the patient possibly has some signs and symptoms, and they want to make sure that there's not a residual from this aneurysm. Okay, so it is true, the post-op diagnosis, that's why they're there. However, we're not coding that procedure. The procedure is actually going in and doing this angiography, and then so she needs to know is which aftercare code will we be using. So let's look at what the procedure was that was done. The statement that gives us the information is there were no findings after the angiography, and it was not specified the original procedure date. How should this be handled? Okay, so let's just give you a brief overview with these images. I am a visual learner. And so this is what it looks like when they go in and do that procedure. Um, I didn't put the footnotes in to everything we're looking at, but you see this vessel and see that metal clip in the first graphic. You've got the 4 pictures. That metal clip is what they did to take care of the aneurysm, which is a bulging.
Mm.
And they're cutting that off so that it no longer bulges. So obviously this patient came in, there was maybe some signs or symptoms, and they think, okay, is this a residual, a late effect of this aneurysm that we previously fixed? And so if you see in the little drawing graphic, you can better see how that clip takes care of that aneurysm. See the little bulge. Now, when they do the visualization and the angiogram, they're wanting to see the vessels themselves. So they're not looking at it in the first graphic, right? That's when they did the procedure. Okay, now that that's been done, the last graphic, that's what they're looking at. So they're going to be able to, although this one wasn't clipped, it shows you where the anterior communicating artery is actually at. And if you see right below the green, um, is that your mouse, the green one on the
No,
screen?
no, no,
Okay.
this is my mouse here.
Okay, that's mine. Woo-hoo. Okay. So it's actually right here. Right here. So see that looks like two this looks like a tree coming up. This little spot right here in between the two arms sticking up. That's that anterior communicating artery. And if that gets an aneurysm, then of course, person can have a stroke very easily, a hemorrhagic stroke. Now, I don't know what it's supposed to look like. This looks fine to me, but that was a graphic that I was able to pull up. So this is what they're looking at, the angiograph, and the findings are, oh, I'll let you move the next slide down a little bit because I can't slide down. I can just move my cursor on the screen. Were you able to see my cursor?
No,
Oh, that didn't do me any
but
good
you were
moving my
very
cursor.
convincing.
I was just moving my giant green cursor all over there and like,
If you
oh man.
want, you can share, and I'll put that up on the screen instead of mine if it's easier.
No, 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 that's okay.
Okay.
I like you driving. Based on the scenario, okay, this is the answer that we came up with, and I want you to know that our intern, kudos because she did all of the work on this, did the research, and I went back and tweaked it. Did an excellent job. And so, if you choose to be an intern with us, you get to really participate in some meaty real world questions. Okay, so based on this scenario, the Z09, which means follow-up examination after surgery for other conditions, is going to be the most appropriate code. That was the question. They wanted to know, is it going to be a Z09.0 or that Z03 code? Now let's talk about why it's the most appropriate. The follow-up codes are meant to say, why is this patient coming back? Now we have a procedure, but we have to explain with the diagnosis code, we have to substantiate why the procedure is being done. And so we are given a list of aftercare codes. So the care's already been done, the aneurysm has been clipped. Is everything going okay? There's 2 things you have to ask yourself. If in fact, when we look at that Z code description, the Z09, encounter for follow-up examination, okay, ding, that checks the mark. After completed treatment, they clipped it, right? So that checks that mark. Other than malignant neoplasm, because they get their own little world, medical surveillance following completed treatment. That's the key. Did they do anything? No. There was no diagnosis. The aneurysm, the clipping, everything was okay. We read that before. So now, if in fact we need to add additional codes, we can. But this is then when you think, okay, I'm in the right place, you have to ask yourself the excludes one. After care following medical care, surveillance of contraception, surveillance of prosthetic da 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 da. Those aren't applicable to what so we get to go past that. So now we look at it and says the patient is presenting specifically for the follow-up of the cerebral angiogram. Now, after previous microsurgical clipping of an anterior communicating artery aneurysm, so that's intimidating, right? Because you're thinking, oh my gosh, there's all these arteries. But we went and we looked and we know exactly where that little place was. We know it was clipped. And so we've increased our knowledge base. We know where that artery is actually located. The encounter represents routine post-surgical surveillance. That's the other key, to assess the effectiveness of the previous treatment, which aligns perfectly with the Z09. All right. Now, Z03, this is what she was thinking, but she wasn't sure. Z03 is encounter for medical observation for suspected diseases and conditions to rule out. Now, from what I said in the beginning, you can see why you might think that's the correct applicable and code, and why you're thinking, oh gosh, it's kind of a toss-up, right? Because the verbiage is very similar. We're observing, right? We're going in and we're looking, and we've got a suspected disease because it said for a residual, and we need to rule it out. That's true. Okay. However, we don't have a diagnosis. So, when a person without a diagnosis is suspected of having an abnormal condition without signs or symptoms, no, that's not applicable here, which requires study. No, we didn't have to really study. We just went in and made sure everything was okay. But after examination and observation is ruled out, the category is also for used for administrative and legal observation status. So as we move down, routine monitoring versus going in and seeing regular follow-up. Is this procedure normally done, making sure that there is no residuals? That's the difference between the two codes. So Z0389, like she was thinking, would not be appropriate in this case because the patient is not being observed for suspected condition. This is not a diagnostic workup for an unknown problem. That none of that was listed. The aneurysm history is already established. We knew the patient had that, so it's not a diagnosis. And this is a planned follow-up of care. It's routine to go in and look after this is done. So Z0389 is used when the clinician assesses a patient due to suspicious sign of disease that is ultimately ruled out after examination. Now, in the beginning, you remember I said they may be having signs or symptoms and they want to make sure there's no residual. Well, was there any signs and symptoms listed in that information we were given? No. This is routinely done after they do that clipping. They have to go in and look. So it's aftercare, normal aftercare. Now, if the patient was having headaches and they were having slurred speech and other things, and they went in to go look to see if that clip was not holding or any other imaging, they've done a CT and they see something, that's different. That's a Z03. But here it is not. Okay, so since the angiogram showed no findings and no residual aneurysm was detected, you can also assign that the patient now has a history of other diseases of the circular system as an additional diagnosis. So the Z86.79, because the patient has an aneurysm. Now, the last thing, wrapping up, the proper way to code this is going to be two codes. And that's going to be your primary code is Z09.0, the follow-up examination after surgery or other condition. And the secondary code is that personal history of other diseases of the circulatory system. There you go, guys. And again, you can see how easy it is, especially when you're out there in the trenches. That verbiage gets a little confusing and you're thinking, oh, wait, which is it? Now you have a better idea of the difference in the Z09 and the Z03 codes.
All right. Well, I don't see any questions in the chat, so you must have explained it. thoroughly.
Aha! They're just so dazzled, right?
All right, so that was a good one. I like how you use the pictures to show the,
Step by step, I found those. Yeah, yeah.
like procedure and then, okay, now they're looking.
Right.
That was a good distinction. Okay, you got another
Mhm.
diagnosis one. Do you want me to go to the answer sheet or do you want to read it from here?
I think let's read it from here, and then
Okay,
we'll go to the answer sheet.
all right.
So the second one is somewhat similar scenario. So we have another angiograph case that is a 6-month follow-up per interpretation. Radiographic interpretation is stated, and no evidence of residual or recurrent right ICA aneurysm, mild in-stent stenosis along the paroxysmal pipeline construct. Per post-op diagnosis, no evidence of residual or recurrent aneurysm. But the provider mentions within the op note, these images demonstrate no evidence of residual or recurrent aneurysm. Okay, that's what we want to hear. There was very mild in-stent stenosis along the, and I think I'm going to do this right, paraclinidal region
Clinoid,
of,
paraclinoid? I don't know.
oh,
I'm guessing
I
too.
think, yeah, I put all at the end, didn't I? Region of the stent construct. Now, this is the question. I'm hung up on the verbiage, and that's what always trips everybody up. Very mild. Should this be coded? Is it appropriate to use the Z09 code for an aftercare code, Z48.812, or can I use T82.856A? If possible, can you explain how long aftercare can be used with Z48 codes and so on? So let's look at the answer sheet. These are very common things to get confused. The verbiage, again, is difficult. And I would say that if you're making notations in your manual, then around the Z09 code, I would make some of the notes that I've mentioned. Are you able to make that just a little bigger on the letters and everything, Laureen?
How's that?
Hmm. Thank you. You know, I have to wear these readers because my brain's so full of knowledge.
We're a lot older than when we
Mm.
started.
All right. So the question that she had ultimately is that term very mild. Now, many of the diagnoses that we deal with have staging, CKD, uh, uh, when people have depression, mild, moderate, severe, things like that. So, again, if very mild, what does that really mean? It's, does that adjective count? Is there a code or a description? Does that mean that the patient doesn't have it or they do have it? So let's talk about what the stenosis is. It was stated that it's stenosis along the proximal pipeline construct, which I think I have a picture of that too. Haha. Refers to the narrowing. Stenosis just means it narrows, right? So the blood vessel, the proximal end means the far, proximal just means far away. No, proximal means close. Distal is far. Okay, so if you're looking at your arm, distal would be your hand, proximal would be your elbow. Okay, so think of that. So, pipeline embolation device. So, this device, the PED, has been put in that has been implanted into the artery, typically to treat an intracranial aneurysm. Okay, so in-stent stenosis or ISS is recognized complication after a pipeline device or a PED is put in. And so since we know this can be a complication, and that's what it would be a complication if you ended up with stenosis due to or around that PED. Now, stenosis is typically defined as a reduction in the vessel lumen, which just means tube, diameter by more than 25% at the side of the stent. That's not for us to decide, right? That's a clinician, that's a doctor thing. However, we should know this. I've really It's a little alarming, but lately I'm feeling like a lot of coders don't have the confidence that they should have in coding to the highest specificity, and it usually is due to a lack of knowledge when it comes to the disease process and perimeters. So if you're going to be working in this area, you don't get to determine, but you need to know that 25% of stenosis is how stenosis is typically defined, because that's going to make you faster and more accurate of a coder. Okay, so do your homework, learn the disease process. Most cases of stenosis after this pipeline stent placement are asymptomatic. Why do we need to know that? Because there's no signs and symptoms when a complication happens, usually, is what they're saying, and may resolve or stabilize over time. So, in other words, you could have a little bit of a stenosis, but it resolves, because that's why they put this device in to begin with, right? And so that's important. So it may resolve over time. However, don't think that that means that it always does. Okay, we follow the documentation. We are strictly translating the documentation. But now that we know that, we know the severity or what they're looking for. But you can have a severe or progressive narrowing, and it can increase that risk of an ischemic event, which ischemic is like a heart attack type thing. So an ICA aneurysm is the internal carotid artery aneurysm. So it's important that you know all the major vessels. You need to know where the internal carotid arteries are. And ultimately, they're the ones that go up inside the brain, or not the brain, excuse me, go inside the skull. The externals are outside the skull, just so you know when they go up. That being said, we know what an aneurysm is. It's that bulging. And whenever you are got a lot of pressure and stuff going around something like the brain, you don't want bulging. So we can go ahead and scroll down, and let's find out what coding very mild. No, go back up. Is that the next one?
Hmm.
Okay, I'm sorry.
You're just here. Yeah, my jumped. Sorry.
Okay. I thought maybe we missed something. So the key is coding very mild in-stent stenosis. She wants to know, should we code that or not? There really is two answers here. So I'm going to give you some guidelines. And again, it all really falls on the documentation. So when the clinician is stating, and clinician is just another term for provider. So when this physician is stating very mild, that is telling. That means the patient does have it. It's confirmed. Okay. So when I look at it, I immediately say, well, it's confirmed. It doesn't matter if it's mild, moderate, or severe, because
Hmm.
there is no labeling for that in the diagnoses, like we have levels of CKD that are defined. So the patient has it. It was identified. However, there's a caveat to that. So now that we know that, the document, when you look at the documentation, it doesn't matter if you are doing risk adjustment or not, you have to have MEET. And MEET stands for that it's monitored, uh, is it evaluated, assessed, or treated? Okay. And so is it just an observation, or is the clinician actually going to do something about it? That is what you have to ask yourself. So, is this an incidental or insignificant finding? The fact that it says very mild makes you lean towards this is insignificant. This is just something that the clinician is noting. However, in my eyes, I say, no, he mentioned it. It's getting coded. But then I am a ICD, I want to know, because I think of the statistical reasons we do things. And so again, we want to capture the statistics of how common is this happening? Uh, so ultimately, what you should do is query the clinician and ask the clinician, are we going, do you want me to code? Are we capturing the stenosis, the in-stent stenosis? Because it is a diagnosis. I can translate for that. And then the clinician, and of course you have to have a proper query, but the clinician, if by the information that we were given, the clinician doesn't, it seems incidental or insignificant because there's no more elaboration about it. Okay. So the answer is you could go both ways. To be safe, you need to query. Is it going to make a difference in risk adjustment? Is it going to mean that the men in black are going to come and get you? No. Okay. And some entities have different policies for things like this. So if you say, well, Alicia said she would code it. Well, that just because I said it and I tell you why doesn't mean that's what you should do. You need to find out what the policy is where you're doing it. Now, for me, I would code it. I asked a couple peers. One said no, I wouldn't. It's incidental or insignificant, and the other one said I would code it. And so it's better to just ask the person who's signing the document. Ask the clinician. Is this incidental, insignificant, or you have to have a proper query again. But do I need to code for the in-stent stenosis? So talking about the aftercare, the Z09 is used for that follow-up care, and it's to check for reoccurrence of or complications. The Z48.812 is the encounter for surgical aftercare following surgical on the circulatory system. So it's used again for right after surgery. So if we scroll down a little bit more, we can see that if
Here,
yep,
aftercare.
yep.
Okay.
So this is how you would look up aftercare, and it's going to tell you to go to Z5.89 or C care, but it says following surgery. Then you can see circulatory system Z48, specific body systems, et cetera, et cetera. Now, she had asked T82.856A, the A just means initial encounter. Stenosis of other vascular prosthetic device, implant, graft, initial encounter. Is that appropriate? Well, it's used for clinically significant stenosis of vascular stents or graft. Clinically significant, very mild, clinically significant. So, however, very mild findings that are not clinically significant is not usually coded. So if we scroll down, and this is what it looks like on those devices, those stents that they put in to give you a better idea. And you can see why there would be a little stenosis in there and things would get kind of caught. And remember, it said that sometimes they go away. It makes sense, right? So the duration for the use of Z48 for aftercare, and I believe that's our last page, is notable because it's when a patient has its immediate and active postoperative period when the patient requires ongoing care directly related to surgery. Z09 becomes more appropriate once the patient transitions into routine surveillance or follow-up. So there's not a time limit on Z09. And when the patient is no longer receiving active aftercare and is instead being monitored for reoccurrence or complications. So for this case, we would use Z09 as the primary diagnosis because it's the follow-up for the angiograph. And we use the Z48.812 only if the patient is still on the active aftercare phase, and T82.856A only for clinically significant stenosis. So if you're in doubt, of course, we're going to query. So what we would do, we'd probably do the Z09, the Z86.79 because it's the personal history of cerebral vascular aneurysm and the presence of that device. We don't need to code the T82 code unless the stenosis is actively addressed, and the query would answer that if you're in doubt, or the Z48 unless is still within that post-op period and we weren't given that information. So that is the breakdown of what we need to do for that Z09 again, which gets very confusing, and if something is a complication of the Z82, if that's necessary.
All right. Very good. Don't see any questions. So let me go back to the slide deck. I think this is time for our commercial break. And basically, oh, by the way, I'm going to put a link in the chat because Alicia mentioned meat. And
Yes.
there's this post. It's in the club. So I did a screenshot because I know not everyone here is in the club. But it'll also give you an image so you can see what our CCO Academy looks like. It's brand spanking new. We had our launch July 4th with the USA's birthday. We had our birthday for CCO. So take a look at it. So the club, wanted to talk to you about the club because the club is really the lifeblood of CCO. This is what keeps us going. The people pay $24.95 a month, and they get all the CEUs that we do. They get access to all of the materials, the replay videos. They get all of the slide decks, the answer sheets, and they get access to us to ask follow-up questions on it. I'm answering questions all the time. So is Alicia. Like that meat one, I just had put that up. What is meat? Because it comes up a lot. And what's really exciting in our club, we now have AI bots that we have trained on all of our material. And I'm going to show you at the end when I'm done with my answer sheet how great it's doing because of the content. And it's really, really exciting. So join the club. Also, what you get as a benefit, if you've ever purchased a blitz, a course, whatever, when you're a club member in good standing, you get all of your stuff back. So you can go in and access it because when the bot answers questions from the content that's existing, it'll give you the sources. It'll show you, oh, I got this from module 3 of the PBC course, the physician-based coding course, or I got this from module 3 of the ICD-10 course. So you could go click in it and go, refresh that information. It's very amazing. So the next slide, so it's just going to show you the price breakdown. You can find this on the website, cco.us/club, but you can see here, this is our monthly club members, $24.99. We have a lot of people that take advantage of the annual. They don't want to have to, worry about the monthly payments. They just, pay it once for the year and they're good. That's $249 a year. So basically you're getting 2 months free or discounted when you do the annual. And then the last one is the CCO Club Plus. So it's the Club Plus a course. And what's really cool about this is that if you come in and you can do a course like in a month, not that we're recommending rushing it, you can do another course. So a lot of people already have on their radar, they want to sit for their CPC. They want to go for their risk adjustment, the CRC. So they already have plans to get multiple credentials. So if you do the Club Plus, if that's you, that would be the package that I would do. Now you get the club and you get the courses. And then when you finish one, you just let us know you're ready for the next one, and we sign you up. And with our new academy, it's even easier to make those switches. So we wanted to encourage you to do that. So it's cco.us/club. And I'll put the link up here shortly. So come join us in the club.
I know that last webinar we did, and we were mentioning the Academy, and there were a couple people that had been with us for a while and did comment on how beneficial it was to have access to the old courses that they had taken and go in and do refreshers, and they get updated. So that was really helpful.
Yeah, and because we update them, you get access to the updates too. So even if you took the
Mhm.
course 4 years ago, you can get the, the updates. So that's
Mhm.
really nice. So this is the screenshot that I shared, and you can see, how we do a topic here and we give the answer. But on the left-hand side, this is I think this is my test user. I don't know, I remember. So here is the club that I'm in. So this is where we put our topics and our discussion. And then the replays is where you go in and get all of the videos and the CEUs and all that good stuff. So anyway, we'll show some more about that in a little bit.
And
But
because meat isn't just for risk adjustment anymore,
mhm.
and so it's talked about in everyday coding. That term works so well, and you hear it a lot.
Yes.
So
Where's the beef?
familiarize yourself.
Where's the beef? Okay. So I'm going to do the next topic. This is was very interesting. I really got into giving some visual aids, and I said, "Oh shoot, I'm not going to have time to do that one." But this one's very meaty, so we'll be doing more. I think it's better to do it more thoroughly than to rush through. So this question was, I need understanding on how to approach this case. Per guidelines, there is a code first, 36216 and 217, and then 36225 and 226. On the answer sheet, I'll show you the codes. What's the proper way to report these? Should I code each additional? That's your 36218 times 4 because of the bilaterals that we'll go into, or should I code 36218 times 2 because of the other areas explored? So I'm going to show you how to go through when you're doing these first order branches, second order, third order, etc. So let's find my sheet here.
And while she's changing that, I'm looking at what it is. And if you don't know, costo means rib. So costocervical, so cervical spine, rib. If you want more information, if you didn't know that, you probably need to take our anatomy course.
Yep. Good suggestion. Okay, so this one was requested by Beverly. She's a CCO club member, and she has been peppering me with questions, or I say me because I've been answering them. And I said, I feel like she's giving me homework. So I'll,
But real quick too, Laureen, this is a good time to tell people that we don't want to do the work for you.
right,
And
right.
so Beverly went in and she said, "This is what I'm thinking," just like on those others. I'm thinking these. Am I right? Or
Yeah.
would you?
Oh, and it's more for a tiebreaker. My coworker
Yeah.
says this, I think that, or the provider is saying this, but I think it's this. So, it's
Yeah.
basically getting a tiebreaker, and that's, that is helps for teaching. So we can
Mhm.
see how their mind is thinking to help, straighten them out. All right, so this was her question. I put the codes here so we could kind of look at it. This is what I need to do. I'm a very visual learner. I have to highlight things and look at this, how we teach people to pass the exam. Compare and contrast the codes. What's the difference, right? So you can see the 36216 from her question is for a selective catheter placement in the arterial system, the initial second order. And what's the family? It's the thoracic or brachiocephalic branch. The 217 is the initial third order or more selective, fourth, fifth, however many splits the vessel takes. Same family though. So you got initial second order, initial third order, or more selective. Then 218 is the additional second, third, and beyond, but it's like an add-on code. It's the additional. And then the 225 and 226 from her question, this is for the subclavian or innominate artery. And then the 226 is for the vertebral artery. So keep those in mind. And she didn't really give me like the op report. She has in the past, and I prefer those. But I know it's a pain to have to redact. So basically, she gave us a summary. So they started off with an introduction of the needle and catheter into the right common femoral artery. I'm going to show you some pictures, so don't go like, oh, I can't visualize this, blah, blah, blah. Actually, I'm going to come back up here as we need to refer to it. But let me just take you to this picture here, because this is the actual breakdown of what's going on. In your CPT manuals, a lot of people don't know this. If you're not a student and you haven't become one with your manual, that's what we teach in our courses. You really need to get so familiar with your manual. And that's why paper manuals are really the way to learn.
Mhm.
Once you visualize and you remember how the paper manual works, using an encoder or like a find a code, then it works so much better. But the CPT manual also has a lot of great graphics and things that explain it. And there's a Appendix L, vascular families. So check that out in your CPT book, and it will really help you with understanding these first, second, third orders. So in this one, she had the right subclavian family, and where did that go? Okay, so you see where I have this number 2, subclavian, right? So we have the aortic arch, and then off of that aortic arch, which I've labeled number 1, is the innominate. So that would be considered the first order. And then it splits or bifurcates, I'd like to call it. And then we have the subclavian. So that's why it's a second order. Then off of the subclavian, it's kind of hard to picture. Let me see if I can make this bigger. Oops. Hope I didn't. Yeah, I messed up my slide. Oh, well. That's a little bit better. So the subclavian goes all the way around, but this is where we're looking for this costocervical trunk, and it comes off right here. So we went first order, second order, so this would be a third order. Then, and they're coming in and they're injecting dye. So just picture like the catheter traveling along. So it comes first, second, and oh, now it's injecting dye here. And it's pulling back out, and it's injecting dye in another third order. So it's 2 third orders is what's going on here. So let me try and put my slide back the way I had it. Okay. So initial third order for the right costocervical, that's your 36217. Then the additional third order for this thyrocervical, that's going to be your first unit of 218. Then going on the other side, the subclavian family, we have an initial costocervical one. So that is a second order branch. So that gets your 36216 because it's your initial second order. And then we had the left thyrocervical. So that becomes your next or your additional 36218. So now we have 2 units of our 36218. Then they also did the bilateral common carotids, which are right here. And there's a special code for that, 36223, and we put a 50. And then the vertebrals, 36226, and we put a 50 because they were bilateral as well. So that's one way to visualize it. Use the picture in your CPT book in Appendix L. And then another way to visualize it is if you're like a table kind of person, they have this table. So if you're coming off the thoracic artery, and because you're reading the op report, you want to find the path and visualize it, trace it out. People that are VIR coders, they have all the charts from like Dr. Z, and they're laminated. Sometimes they'll use like those wipe on, wipe off markers. So this is your inanimate. So that's your first order branch, and see on the top it says first order. And then off of that, for our particular case, we came through the subclavian. That's our second order. And then this branches into 1, 2, 3, 4 different vessels. Our provider worked on these two, the costocervical and the thyrocervical, and they're both third orders. So that's why we're when we look at the codes, we're doing the initial third order 217 and then an additional second or third and beyond. It doesn't matter if it was second, third, or fourth or whatever for the additionals. You tracking with me? Give me feedback.
They are super quiet. They
I
are
know.
entranced, but I really think they appreciate, because I know I do, the two different ways to look at it. The
Yeah.
visual of the structure itself and that table. Some people that I'm sure aligns with a lot of people too.
Well, sometimes on these images, you're like squinting and you're looking, is that coming off of this or not?
Mhm.
So if you go to the table, they tell you, like,
Right.
all right, here's my oh, okay, that's branching off of this, which is branching off of that. Got it.
Mhm. Yeah.
So that helps a lot. Then, of course, they did the angiography, the imaging, because you don't just put the catheter in there to squirt dye and walk away. You take a picture. So that gets reported separately for each vessel that's studied. So we had 1, 2, 3, 4, 5. So you had 5 units. And the note here is the right vertebral and common carotids lack documented angiograms. That's why you're probably thinking, but wait, you had the codes for, but if you didn't document it, it wasn't done. So that was what we noticed for these. And then ultrasound guidance was mentioned. So that's your 76937, professional component only, to get the physician paid for their work. Wow, I thought it would take a lot longer to do that.
No, well, that's
Long to
pretty
prepare.
intense, doing those two different ways to do that. So, I think one of the takeaways is that it gets very confusing because you're dealing with multiple codes. But if you do this type of work, which again, if you're coding these, you're doing you're doing these all day. And it becomes you get them memorized. So yes, it's a lot of codes, but so is knowing a lot of people's phone numbers, which I guess isn't a really good, because now we don't know people's phone numbers because we have cell phones. But again, once you get the feel for it, this is not intimidating at all. And then, as Laureen said, you can go to Z Health and you can literally they have all of these great tools to help you. Let's see.
I'm
Uh,
gonna share something. Oh, did we have a
yeah,
question?
well, Christopher just says, I struggle with the guides. Thank you for working through the table. Again, I think is really helpful. For myself, I want to see the anatomic structure because that's what I know. But if you're not into that, having that listed out, that and knowing one leads to the other, then leads to the other, this is a great way to get familiar with that anatomy and the verbiage, because this is the way it looks on the report.
Right.
The report doesn't have the diagram.
No.
I know the names of the vessels and stuff like that, but so this vascular family, if I look at that confuses me when I look at this. But if I go look at the diagram and you say, oh yeah, that's that vessel, that's that vessel. So it's important to know what works for each person.
And
Thanks,
here's the
Christopher.
tip. First order can change based on
Mhm.
where you start.
Mhm.
So be careful of that. So in this one, this is the most common coming off of the aorta, So anything coming off the aorta is the first order branch. That's commonly how it's done. But you could start in a second order branch. It's
Yep.
possible. So be aware of that. So this is the Appendix L. And it's a vascular branching model that assumes the aorta or the vena cava, pulmonary artery, or portal vein is the starting point of catheterization. Accordingly, branches have been categorized into first, second, third, and beyond. Note that this categorization does not apply, for instance, if a femoral or carotid artery were catheterized directly, because that then becomes your starting point, and anything off of that is first, second, third.
Mm-hmm.
So common branching patterns of typical anatomy are shown in the charts and illustrations. No specific coding instructions should be inferred, and users must determine how to best code any specific procedure based on variant anatomy and different vascular access points relative to the vessels selectively catheterized. So you might have to go through the subclavian to get to these. We did the thyrocervical and the costocervical. But if they didn't stop here and inject dye, then we're not coding this. This is just the path to
Right.
get to these endpoints. We're coding the endpoints where they injected the dye. Oh, reverse, pull out, go into the other third order. Okay, inject dye. So those are our two endpoints that we're looking to have codes for.
And you can now see videos of these done. And so it's kind of like all in black and white, but that may help you link your brain to the codes and some of this verbiage. A lot of times they're talking while they're doing that. I would encourage you to go out and look for those. I don't know if they're on YouTube I used to go to OR Live, literally O and R live. And so that may help it click for you.
So here's a question. Get your thinking cap on. So here, for the right subclavian, it's a second order coming off the thoracic aorta. Then we come down here, coming off the thoracic aorta, left subclavian is a first order. Why is that? So if we go to our picture, I think it's on this one. Was it here? Now I can't remember. Yes, here it is. If you look at these subclavian, look at the anatomy, how it's different. Coming off the aorta on the right, I know on the picture it's on the left, it gets confusing, but this is considered a first order piece, and then it splits. That's why this is a second order on the right. But this subclavian, there is nothing like that. So it is a first order. Isn't that cool?
So you have to think of the tree, and a tree limb always, forks. That's what they're looking for, those forks in the road.
Mm-hmm. Yeah, so keep that in mind. Hopefully that will help you. If this is one that scares new students, and you just think of branches on a tree, and you come off the trunk. Think of that as the aorta. And once you can get the main trunk analogy and the first branch that comes off the trunk, and then where it splits, that becomes second order. You follow one of the paths, and wherever it splits, that now becomes third order. So once you can do the coding from there, then you can handle if you get a different starting point. Okay, where's first, second, third, and so on and so forth.
It's intimidating for me because I am not a CPT lover. However, I know the anatomy, and I really love the anatomy, so that kind of makes up for it. But that is a niche that some people just fall in love with, and there is a huge demand for interventional radiology or IR coders. So if that's an area that you would like to get into, you can start working in cardiology, and then they get paid very, very well. It takes a while to build up your skills, but it is a fun area to be in, and people appreciate others who have that skill.
Absolutely. Well, I'm glad I didn't get to the other one because we're already at top of the hour.
Yeah. When you said that, I was like, we're really close to the end.
So we just wanted to end with sharing a little more about our new academy. We did a walkthrough webinar last Thursday. It was last Thursday. So you can catch that on the YouTube channel or in the academy itself. But basically, it's using a new platform. We've come a long way. We started with using email groups back in the day to using a discussion forum. Then we used Podio, that didn't work out so great. So we went back to the forum, and now we're using what's called Circle. So we love it, and it's so powerful. We've had to spend a lot of time getting it set up. So our staff has been wonderful. Alicia and I are the passenger princesses, and they did all the copying and pasting and all that kind of stuff. Alicia more than me, but but she's the presenter. We need her to do that. So it's going to have, it already has all of our activity in there, the club, the replays, the conversation. So let me just take you in there. I think I have, here we go. So this is what it looks like. You can have it with a light background or dark background. I prefer the dark background like you saw in the screenshot, but for purposes of webinar, they say it's better to do it in the light background. So I am logged in as my little test user account, Florida Laureen. You'll see her on there because I now live in Florida. And it's so simple. When you log in, it brings you to the feed page. So if you've ever used Facebook, which I think all of us have, you get a feed. And if you've joined any groups, those groups come into your feed. We set it up the same way. So any groups that and they're called spaces, any spaces that you're a member of will go into that main feed. But if you only want to look at the feed for the club, you just click on that and it filters your view. Now you're looking at all the club information. And you can see here, there's my What is Meat post. And you can see the interactions. You can do the likes, just like any other kind of social media platform. So it's very modern feeling. And when you see a topic you want to dig into, you just click it. And you can go in and look at it more. You can bookmark it. You can follow it if you want to make sure you get notifications if someone responds to it, like if it's a question that you posted. And so everything on the left are just different spaces you can go into. The open discussion is our free area. You don't even have to be a member. You can come and go to www.cco.academy. And if you don't already have a login, then you just say sign up, and it'll get you signed up, and you can come in, and these top 1, 2, 3, 4, 5 will be open to you, and you can go into them. We'll be putting all of our events, like this is one we're doing tonight. You get nice little notifications in your email. You can come look at the calendar. It's very helpful that way. This is where we have our free CEUs. We got our 2025 ICD-10 update and our 2025 CPT update. We do that every year. We do it for free. And this is where you can come watch it and take your CEU quiz and get your 2 CEUs every year. And then we've got all of our help desk articles. We've got, I think, 126 articles in here. So you can also filter once you're in a space. All these on the top, they're just little tags to filter. So if you only want to look at stuff having to do with, let's see, exam and certification, it'll filter that view. So we have test taking tips and strategies. You just click on it and you can go read about that. Oh, happy birthday, because it's the club launch. So, and we've got little hyperlinks for you to go look at more bonus material. So it's very, very helpful. And we have a bot, a help desk bot. So if you click in the search and you want to type in something like, how do I register for something like that, you can ask the Ava, that's our support bot. And Ava has been trained to search the entire help desk, every single article, and will come up hopefully with a reply. And she says, thinking. And then she found the answer, tells you where to go, and even tells you the source where she got it from. And it was from one of our articles in our help desk. So it's pretty awesome. And what's cool is if Ava isn't getting what you need help with, and honestly, a lot of times interacting with bots, you have to become good at how you prompt the bot. You've got to really give it as much context as possible. But if Ava can't do it, then I think the safe word is human. If you say, I need a human to help me, then that will go into our queue and we'll jump in and we'll help you from the help desk. So that's Ava. And then we've got a little chat where it's just more like a text chat where you can kind of get quick help. And these are all collapsible. So if you want to just, shrink it down, you can, or expand it. And then I showed you the club area. This is the replays. So we're pitching the club tonight. So here's all of our club replays with CEUs. So those are listed at the top in date order that they're going to expire. So this one, the July from last July, is going to expire the end of this July. So if you want to hurry up and get that one CEU before it expires and you're in the club, start with that first. And the way it looks is just like this. The videos play very nice. You'll recognize the jingle there. And you can ask questions on the content over on the right by clicking this, this question bubble, comments. So you can type a comment in. If you have a question on the material as a club member, we're here to support you. If you're like, can you clarify that point that Laureen was saying about the aortic arch? And then we will get the notification. We'll come in and answer it. Or oftentimes a community member jumps in and answers. And then you can toggle back to this view, which is all of the available ones that have a CEU. So you can see we have quite a few CEUs to choose from. We even have a CEU mini course that has 9 CEUs. And then we've got all the replays from the past where the CEUs have expired, but they're in here. And you're like, oh, that's so much. I'm not going to watch all those. But the bot has watched them all. And the bot can answer questions from it. It's pretty amazing. We have some people in here where I turned it off temporarily because I was working on training it. And 2 students were like, hey, where'd the bot go? And I said, oh, I didn't think anyone was using it. I love the bot. Like they're developing a friendship with the bot. So,
yeah. But if you have a question, say, everything, there's a lot of videos on that we've done on diabetes, but say you want to causal relationships in diabetes, the bot will go in and pull the applicable webinars that we've done, with diabetes and causal relationships. So that's
what was that question?
Diabetes and causal coding, right? Yeah, for diabetes diagnostic coding. I don't know if that.
How do you want to word it?
I would say, how do I code for diabetes and causal relationships? CAUS.
All right, now that one, we're going to go to Cody because Cody has access. This is the premium bot. It's only for club members and students, but it searches every single piece of content we have on the Academy. So all of those replays, every single course lecture, everything. So let's see how Cody does on this question. I have no idea. This was not staged.
I just know we have content in that, and I'm curious to see what it pulls up.
And the great thing is if we see someone asking, say, a question for the support bot, Ava, and it's not getting it, then I'm like, that means we don't have a good help desk article. So we'll go write it and put it in there. So the next student that comes along, I just love even how well it formats. So I don't know, Alicia, how'd Cody do?
Coding guideline, causal relationships right there. Let me scroll down. It didn't give any of it. It gave answers, but there, three sources down there. I want to see what they used as the sources. Oh, there you go. Right. That chapter, right. Yeah. Bonus coding guidelines and practice management and yep. ICD coding conventions. Excellent.
Yep. And then you can ask a follow-up question on it. So I have one person, she was having like a full-blown conversation. Like I'm watching it because as help desk people, we're supposed to help if the bot isn't getting it. And she just went on and the way she asked questions, I asked her if I could interview her. She's thinking about it. She's camera shy, but she said, I'd love to share. She said, I didn't think I was doing anything special. I said, no, the way you ask your question, you're getting the better information. And maybe we'll do a webinar on that, like how to ask good questions
AI
of
questions.
AI,
Yeah.
but
That's awesome.
and this will always be in your little inbox, so you can come back and look at it. So now you don't have to go search all of the replays to try and get an answer. It's going to do it for you.
Right.
That is just mind blown. This is so cool. We're at the highest tier on this program. It's super expensive. Let's just say for 1 month to have this is what I was paying for 1 year of the other one. So that's why we're wanting more club members to help support this. But the more we build, the more we put in here, the cases that you give us and we code, that goes into the hopper and gets processed by the bot. And if that comes up in a future question that someone puts in, they'll see that resource. Oh, that was an answer sheet that was answered in 2025, and so.
And the fact that you send in questions for us to add, like we did today, that goes into the system. So those questions that are pertinent to your everyday coding world is not only going to help you, but it's going to help people in the future. And so that's why it's doubly appreciated. And you spreading the word that we have this resource for you.
Yep. And then this is the Bat Cave, where we have our annotated CPT, and we have some ICD BAT files as well. And you can go in. This is what a course typically looks like. It lets you know how many lessons there are, what your progress is. And so if you wanted to do, say, integumentary, you could come in and you start to watch the video, and it allows you to copy notes from our book into your book. So, and then this on the right-hand side for all of our courses, as you complete them, you get a nice green check mark. So it's very motivating, and it also helps you know where you left off. And then when you're all done, you click complete lesson. For this, there's no quiz. You're just using it to get access to the information.
And just working through that BAT system, that technique makes you better. It works for visual, it's tactile, it's great.
And the BAT is included in the club membership. It's included with the courses as well. And so we don't sell it separately. It's part of our courses and the way we teach, but it is a benefit that we give club members. Then we have ancillary courses. Now you probably wonder, why are there these padlocks on there? Well, this is my demo account. So Florida Laureen signed up for medical terminology, and here's that course, but she didn't sign up or enroll for ICD-10-CM or PCS. So it's called a lock screen. So if I'm curious about it, like I wonder if I want to take this, it says enroll now, and that'll take you to basically where you can pay. But you get a little preview of the courses, of the lessons. So you can kind of see, oh, wow, and you can see how long the videos are. And you can decide, yeah, actually, this looks like a very comprehensive course. I'm in, and you enroll. And the good news is when you're nearing we give you 9 months. AAPC gives you 6 months for their courses. When you're done with the APC, I think they charge you about $50 a month to extend. With us, you just become a club member, $24.95, and that extends your course because that's one of the benefits. So that's oftentimes when people will first become a club member. So there's different ways to do it. By the way, if you're in as a free member in the Academy and you want to ask a question, like, well, what if I buy this? What if I do that? I was thinking of doing this. You can go to the chat bot and just say, I'd like to talk to a human, and then we'll come on board and we'll come help answer your question. It's a lot more efficient than opening up a help desk ticket or trying to schedule a call. Just jump over there, and it's been working out really well. And we take turns covering it. I do evenings and weekends, and we got William and Sylvia, and Mary jumps in too. So these are all of our ancillary courses, and we have our core courses. We've got all of our review blitzes. We've got our free practice exams, our paid practice exams.
Linda has a question.
Uh-huh.
Can you see it pop on the screen?
Could you answer how to access your courses that you've already taken in the past? So you should be able to see a dot. If you don't, then reach out to the help desk. But your courses expire unless you became a club member when your course expired, then you do lose access. However, we have been letting people that have joined after the fact. That's going to probably be changing soon. So if you want to become a club member now to get access to all your previous purchases, I would do it now, because our rules are going to be changing soon, because we've had some people, unfortunately, that go off, come on, go off, come on, go off, come on. And we have to manually set them up every time. And it's costly. So the idea was become a club member and stick with us,
Right.
Show us your commitment. We'll give back by letting you have access to everything you had before.
Okay.
So if you're not seeing the dots, in the transition, something might have gotten stuck, and we have to give it a kick, and then it'll give you your access. So just make sure you're a club member to get it. Now, if you paid within the last 9 months, then yes, you should absolutely be able to see your courses, but you should see a colored dot, and you should be able to go in and be able to see your lessons. Now, of course, since we just started this, many people are midway through their course. All you need to do is go into the lesson that you already completed and mark it complete, and then you can go to the next one.
Yeah.
The medical blitzes are updated every year for the courses you have in the past. Not every year. Sometimes we'll do an assessment. If there wasn't a whole lot of changes, then we might not do it. Like I didn't do one this for 2025, but then I'll definitely be doing one for 2026. So we kind of take a look at what the changes are and see if it's necessary.
Yeah. Sometimes it's just an addendum. It's something small.
Yeah.
Because honestly, guys, the guidelines don't change very seldom. But instead of redoing the whole thing.
Yeah. And we cover the updates at the end of the year. We go over the New Year's ICD code changes and the CPT code changes. And those are available to everybody. Those are the free ones. Mm-hmm. So we cover it one way or another. I don't know. Anything else you guys want to know? Just wanted to kind of give you a preview. If you're an intern, you got your own little discussion area. We've got the links. Oh, you want to, it has an app. You could download an app. So this could be on your phone, and it's really slick. It's so, I take it with me when I'm on the phone. I can look at all the chats. I can look at the questions. I can watch a video. So, it really is good quality. So if you're traveling in the car and your spouse is driving, you could catch up on a video. It's really good for listening to the podcast. So yeah, that is one of the main reasons I wanted to get a fresh update. Our forum software was working great, but it wasn't mobile friendly. And it was meant to be a discussion board. It wasn't meant to be a course delivery system. We made it work though. But this is made for courses and lessons and all of that. It's not so strong on the test side, the quiz side. So we're going to keep our current exam platform, and until they get better. But this company's making changes like all the time. So at any rate, thanks for letting us show you around. Do we have any other questions?
I'm just letting Angela know that she can update her information on her payment. She got a new card.
Ask the bot.
Yep.
Join the Academy and ask the help desk bot, and it'll give you the link.
And then let's see. Bethesda had asked about, do we have annotations for the PCS, IC-10 PCS? We do not. However, if that's something that you would like to see, we can definitely make plans to do that. It's the guidelines are not very intense for PCS, but we can absolutely get some insight on those
And
issues.
any
So it's
ideas for
necessary.
tools like that that you would like to see developed? These are perfect things that
Mhm.
the interns are looking to do. Everything we have the interns do, we want it to have an educational component, so it's valuable to them, but it's also valuable, to the community. So any ideas like
Mhm.
that, well, that's another thing. I'll show it next webinar, but we've got a ton of freebies. If you go to cco.us,
Yes.
you'll see right there it says freebies. We've got, the modifier grid, lots of like handouts to
Mhm.
help you understand topics. But if there's something you want us to develop, let us know. Put it in the
Mhm.
topic request. Might not necessarily be a topic you want developed, but you could say, could you develop a tool to help me visualize X?
Yeah.
Then we can do that. We have mind maps in our
Mhm.
courses, and mind maps that, kind of take a tough concept and make it very visual.
And sometimes it's all about, provider education, clinician education, CDI.
Mhm.
What do you need your, doc to be documenting so that, do they need a resource? And we could create something like that for you that's special, is, that would meet your needs.
Absolutely. All right, everyone. Well, thank you so much for your
Sticking
kind
around.
attention, and we look forward to developing some more answer sheets for you and tools and all that good stuff. So join the club if you hadn't, and if you can't, then at least tell your friends about the new CCO Academy so that
Mhm.
we can get as many people in asking questions and engaging and just giving that bot all of that good information to be able to answer
Mhm.
our real world coding, billing, risk adjustment, career advice, all of that.
Mhm.
So
Thanks,
thanks, Michelle.
guys.
You're awesome too. All right. Goodbye,
We'll
everyone.
we'll see you
Well,
next.
are we doing
uh,
one next Thursday?
I'm not sure, but just go ahead and mark out Thursdays for
Yeah.
CCO. Thursday nights is CCO night,
Yeah.
you know.
Good idea. Good idea. All right, everyone. Be well.
Looking for medical coding, medical billing, and risk adjustment education? Learn more at cco.us.